Get ready to hear the truth, the whole truth, and nothing but the truth about the United States healthcare system. With your host of the Medical Truth Podcast, James Egidio.
Hi, I'm James Egidio, your host of the Medical Truth Podcast, the podcast that tells the truth, the whole truth, and nothing but the truth about the American healthcare system. Just to put out a disclaimer before we get started. This podcast and its associated content, that's the websites, articles, provides general information and discussions about health and related articles and subjects. The information and other content provided in the podcast, blog, website, or in any linked materials are not intended and should not be considered or used as a substitute for medical advice, diagnosis, or treatment. Please consult with your personal physician. Now that we got that out of the way, my guest has a long history working in the pharmaceutical industry. He has over 40 years experience as a scientist. He is the co-founder of Viral Forensics from 2015 to 17. His areas of expertise include AIDS, arthritis, cancer, drug design, and clinical diagnostics. He was a participant in the Presidential AIDS Advisory Panel in South Africa, as well as the author of a multitude of scientific articles and books, one titled Germ of Lies and another called Virus Mania. In the fall of 2015, he wrote an article titled Tyranny of Dogma, which is a must-read if you want to understand just when and how science died in our country. This is an uncensored and intelligent conversation in regard to the truth about the COVID pandemic and the state of the scientific and medical community. When it comes to disease and what has evolved in the last 3 years, it is my pleasure and honor to introduce my guest on the Medical Truth Podcast, Dr. David Rasnick. Hi, Dr. Rasnick. How are you today?
Hi. It's a pleasure to be with you. I have to make a little correction there. I'm not the author of Virus.
Okay.
I'm not the author of that. And I also worked on emphysema, arthritis, and parasites, as well as cancer and AIDS. Yeah.
Mm-hmm. All right. So you didn't work on that you didn't author that article, or?
No, that was a book. Virus Myth is a book. A friend of mine in northern Germany, Klaus Kernlein. He was one of the two authors of that book. I'm not the author of that one. Yeah.
Oh, okay. I'm sorry.
I don't know how I got associated with that.
Yeah, I don't either. So what I want to do before we get started, because you did write a paper in the fall of 2015 titled, The Tyranny of Dogma.
Yeah, the tyranny.
And this was written in the fall of 2015 for those of you that are listening and watching this. And what's interesting is seemed like you're way ahead of what's unfolded in the last 3 years with the COVID. And I just want to read the first two sentences of that. And this is how it starts. It starts with, the resistance to the correction of error in scholarly publications is merely a symptom of a much larger systemic cancer corrupting professional and governmental institutions. Indeed, all of institutional science. Research is driven not by a desire to determine objectively whether a hypothesis is valid, but rather by the will to make hypothesis appear true. And that was written by the pervasive problem of misconduct in biomedical sciences. And then it goes on to say, the scale of the problem is such that any meaningful correction is impossible, and retraction would wipe out well over half of the published scientific literature of the past half century. So my question is, how and why did we arrive where we are at with science and medicine today?
Okay, that's a long story, and I will get into that. But for your viewers and listeners, let me direct them to my website, because it has that article that you mentioned among a whole host of other things.
Sure.
That they might find useful and helpful. DavidRasnick.com. That's just my name, David, and RASNICK.com. And I have those things on the homepage, a lot of stuff on the homepage. There's about 40 years worth of material on my website. I have it broken down into different categories and things. So you can actually download The Tyranny of Dogma. You can download a couple of my books, also Peter Duesberg's book, or two of his books on AIDS. And there's a lot of stuff there, lots of videos and everything else. A lot of our cancer stuff's on there. And so if you feel like during the course of our conversation here, your audience, and they want to dig in and find out a little bit more and be talking a little fast here, and what did he say? You can go to my website, and there's, like I say, tons and tons of stuff. And I have an email that you can contact me with any questions. My picture is on the upper right-hand corner of my homepage, and to the left of it's a little envelope. That's click on that. That's my email address. And you can ask me questions or whatever, and I can direct you to help you find the answers, that sort of thing. So I just wanted to let your listeners know that not to worry if you miss something or if you have other questions. There's a way to drill down on this stuff. So we'll go ahead. Let you go ahead and ask me that question again.
Yeah. So getting back, you did the AIDS research back in the 70s and 80s. And what I wanted to talk about is how and why did we arrive where we are at with science and medicine today? And, and how does your research with HIV in the 70s, 80s parallel with COVID?
Right. It was actually the 80s and the 90s, but that's all right. 80s and 90s?
Okay. All right.
Yeah. When I started, I got my PhD, Georgia Tech in 1978, and I was one of two chemists hired by Abbott Laboratories to set up the chemistry group in their diagnostics division. So I learned a lot about clinical diagnostics while I was there. And I left there in, I think it was the fall of 1980, moved to San Francisco and started my first company, relocated one actually from Indianapolis with a co-partner there to the San Francisco Bay Area. And of course, in 1980 was when the what we eventually came to know as AIDS had actually been starting in New York, San Francisco, and LA among gay men, primarily back in the 70s. But we didn't really get it publicly known too much until the 1980s. And there I was, one of the hotbeds of it in the San Francisco Bay Area. So scientists would get to meet academics, companies, all different kinds of professionals once a month. We'd go to a seminar, and then after that, we'd go to a Chinese restaurant afterwards. That's the primary reason why a lot of us went. And then we'd talk to each other, share what our expertises are, and we talked about AIDS. We'd always talk about AIDS because it was a brand new thing. It wasn't even in the media at that time. But it was sort of like an alien disease. It was so bizarre. And of course, there it was in San Francisco. And we all wanted to work on it. We talked about this a lot. And then in 1984, it's April 23rd, 1984, it was the election year, end of Reagan's first term in office, and he hadn't mentioned a word about AIDS. And in order to keep the Democrats from turning AIDS into a campaign issue, they called, the Secretary of Health and Human Services called a press conference, Margaret Heckler, on April 23rd, and brought out Robert Gallo. And basically they set U.S. policy on that day that AIDS was caused by one of Gallo's viruses, a retrovirus, was started in Africa, sexually transmitted, and is invariably fatal. And that is AIDS dogma to this day, and an official government policy. And on April 23rd, there was not a word of this published anywhere, in any scientific medical journal. All the world that was paying attention, including the scientists, we'd never heard a word about this before except on that press conference. Okay, so that's shocking right there. Now, I didn't know that at the moment. I only learned that later, those specific details about there was no publications or anything. I just figured it must be published someplace until you go back and you try to find it, and there's nothing there. And I then, about a year later, 1985, it looked like AIDS wasn't behaving anything like a contagious disease, sticking strictly to these gay men primarily and only causing certain types of pathology like Kaposi sarcoma in them. And then it would be like some sort of other kind of pneumocystis carinii pneumonia in IV drug users, and something different in hemophiliacs, so something different all over. And women weren't getting it at all, So I said, I started raising this question with that group of professionals that I've mentioned there in the Bay Area, University of California, San Francisco, Berkeley, a lot of little biotech companies that were there, that I said, this isn't behaving like a contagious disease. And this is when my so-called light bulb moment happened, was when my colleagues that I've been talking to for any kind of thing for 4 or 5 years refused to talk to me about AIDS. In fact, they were afraid to talk about it. And my best collaboration that I had was with a parasitologist, and we did not want to lose our collaboration. So we mutually agreed, he didn't want to talk about AIDS. We mutually agreed that we wouldn't talk about AIDS in order to keep our collaboration alive. So I lost a lot of colleagues, potential collaborations, and other sorts of things. Now that was very, very strange. And that's when I started looking into what is this phenomenon? And I came across, digging deep in all sorts of ways, looking into the gay community. I got this book, Disciplined Minds by Jeff Schmidt. It's a great, great book, Disciplined Minds by Jeff Schmidt, who basically can answer the question that you raised, but I can give it from my own personal experience. How is it that these professionals, academics, clinicians, could be journalists, they could be anybody that has the potential to influence a large number of people, for example, how it is that they've gotten sort of constrained, brainwashed, the inability to talk about certain dangerous topics, like the HIV hypothesis or a coronavirus like COVID-19 and SARS. Right. The similarities between the story about AIDS that I'm going to tell you about is almost all the difference between that and COVID. There are two differences. One, the names are different. Instead of AIDS, it's COVID-19. Yeah, instead of a retrovirus, it's a coronavirus. And instead of being restricted to IV drug users and gay men, now it's global. Right. But sure. The entire infrastructure that is kind of destroying the world to this day was put into place during the AIDS scare of the 80s and 90s. I witnessed it firsthand. All right. And so that was the first thing. Now, a lot of this, I didn't know all these details immediately. As I'm saying, you're getting about 40 years of my background, and stuff that I've learned since then, how to put this stuff together.
Right.
And in 1987, Professor Peter Duesberg at University of California, Berkeley, right across the bay from where I was, he published an article in Cancer Research. He's the world authority on retroviruses. HIV is a retrovirus. And it was like a legal document. It was a scientific report, but it's like a point for point for point for point, how it is retroviruses in particular, and in general, and HIV in particular, do not cause disease, cannot cause disease. They're not sexually transmitted. And he totally destroyed the whole thing. And since he didn't keep quiet about that, he hasn't, once that came published, he never had a grant proposal turned down prior to that publication. He's never had another one granted since that publication. See the pressure that you can put on a guy who's a member of the National Academy of Sciences, was on the road to getting a Nobel Prize, and all that was destroyed because he wouldn't keep his mouth shut in his criticism of the HIV hypothesis. All right, that means science is dead. When you cannot ask questions, science does no longer exist. Without questions, science is dead. That's why I tell people I witnessed firsthand the death of science in 1984. Certainly the mid-80s. It is dead. If you have any politically significant science anywhere in the United States, probably in the world, it is not science. It's just dogma, and it's just to commercialize things and to try to make money or do whatever it is. The certain areas that aren't politically significant, I imagine that they're fairly free. That doesn't mean that there aren't good scientists, individual scientists, but their numbers are fewer and fewer because they're scared to death. If they have to write a grant proposal, which comes from the government money, it's taxpayer money. Anthony Fauci is no longer there, but he was the one that checks it off. You got it, nixes it, or whatever. They know the game, and that's what they literally use those words. The people that stay, Peter Duisberg, they say, did not know how to play the game.
Right.
And get punished for it. Now, this was in the 1980s. Now, the COVID thing is the AIDS scare on steroids. It's even worse than that.
Right.
It's global. There are no adjectives, really. I can't think of any adjectives that really satisfactorily capture what we're in the midst of right now. So I tell you what, I'm just kind of rambling on here. Why don't I give you a chance?
No, it's interesting you say that, because I'm thinking as you're talking that we even have, as you said, back then in the 80s, this goes back as far as the 80s, you would think that this was something new as far as the, the science being the science that it is, because we all know that the narratives are being led by the media, which, as I was telling you earlier, before we even started this podcast, that's what incentivized me to get this podcast going was, having been in the medical field for 24 years, like I have personally, hands-on practice manager, owner, that I'm seeing, people like yourself and Dr. Judy Mikovits and doctors, Dr. McCullough, and people that are very well versed and have seen patients or have done a lot of research in medicine get censored. And it was so obvious. But you talked about the AIDS virus and the research that was done and COVID. And it's so interesting that coincidentally, I believe Anthony Fauci was involved with both, right?
Yes. In fact, all the ones in between.
All the ones in between.
The Ebola, the Zika, and all the other stuff, all the other phony plagues in between.
Yeah. So what I want to do today is I want to unpack a little bit the parallel between you as a researcher, which you've witnessed kind of, maybe side by side or parallel the similarities between the COVID and the AIDS, HIV.
Yeah. Well, as I mentioned earlier, the supposed cause are viruses. A retrovirus is for HIV, and a coronavirus is for COVID. They have the idea of these viruses. As I said before, these retroviruses are totally harmless. We all have, I forget what sizable fraction of our genome have retroviral sequences in it. They're probably us. They're not even transmissible. They're not sexually transmissible at all.
Right.
But they have these gene sequences with these particular enzymes that are very, very useful to us. In fact, they found what they call the human versions of these things that do the same thing as these retroviruses. That's why I think they're probably the human viruses anyway, or the mouse virus or whatever. We have these enzymes that help us move genes around and communicate from cell to cell in our bodies. And I think they've misinterpreted this idea of a retrovirus like HIV. HIV, nobody's ever found it in a human being, by the way. The only place I know of personally that exists is in the laboratory. I think my personal feeling is, now that I've looked at it over the decades and studied it a lot and go back to the old literature, Robert Gallo basically is a laboratory artifact. Look at it this way. HIV, this is the hypothesis. This retrovirus infects your T helper cells. It's the type of immune cell. This is the theory, the dogma actually. And then because of that, your immune system conks out, and 10 years later, you die of all these sorts of diseases. All right. Now, the thing is, nobody's ever found these things in a human being. But and Robert Gallo got the sample. He basically eventually took it and kept it as his own. It came from Luc Montagnier, France. Luc Montagnier got Nobel Prize for discovering HIV, but not for the discovering the cause of AIDS, curiously. And Robert Gallo turned that sample, he tried to culture this virus from this patient sample in human T cells. And of course, it would not grow in human T cells. He couldn't culture it in human cells at all, which right there is a first sign that there's a problem. If the theory says it infects these cells and it kills the cells and it disrupts your immune system, and you can't grow it in T cells, that's a problem. So Gallo eventually wound up searching for different cell lines. He came with, I think it was a leukemia cell line, and he forced it, mixed it with that sample from Luc Montagnier, put in lots of chemicals and everything. Really stress the cells, and the cells, as they're being stressed, they produce these things called exosomes, which is very, very well known in biology when people do cell culture. And our normal body produces these exosomes. Basically, what it is are these little vesicles that leave your cell, and they have encapsulated them some proteins, maybe some enzymes, and some nucleic acids. And then they're out there circulating around. In fact, on a normal healthy situation, they help you communicate from different parts of your body. But he generated these things in a non-natural setting in the laboratory, and he have these things, and he calls them HIV. Originally, he called them HTLV3 because Gallo had been trying to find these retroviruses as a source of disease for years. The HTLV stands for human T-cell leukemia virus. So he was looking for a virus cause of AIDS. He was working at the National Cancer Institute, and under the theory that viruses cause cancer, which they do not, by the way. But he did in a very similar way generated these pseudoviruses, HTLV1, HTLV2. None of them cause cancer, and then he had his HTLV3 was what later became called HIV. For human immunodeficiency virus. It was just one of the latest of his little things. And it fit in perfectly with the story that the federal government wanted, all right, in 1984. And it took off. It made Gallo famous. Fauci became the director of National Institutes of Allergy and Infectious Disease, November of 1984. He pushed the AZT, a very, very toxic drug that probably killed a journalist, Lauritsen, estimated 330,000 gay men between the late 80s and early 90s. And we have with remdesivir that Fauci's pushing for SARS-CoV-2. Who knows how many tens of thousands, hundreds of thousands, who knows how many people he's injured and killed with remdesivir.
Right.
And I mean, the parallels are absolutely astounding from one to the other.
Yeah, and it's interesting you say that because if I remember correctly, I was still just getting out of high school in 81, and when this was all kind of being ramped up with HIV, they were talking about, I guess the original vector was a monkey or something in Africa, some kind of a monkey. And
I don't know if that's exact, but it's always this, these things always come from Africa or Asia or something like that.
Right.
There's never a red, white, and blue virus, Right.
And then again, the parallel with the China virus, because it's from China, is that it was from a bat at a wet market. So then now it's all coming out now about the whole thing being, this gain of function. So are you saying that the HIV virus as well, or the supposed AIDS virus, was manufactured in a lab, or just never existed, or what's the theory on that?
It was like my story said. I think Gallo, I know a lot of people, I even used to accept this notion of viral diseases. No longer. I don't think there is such a thing as a viral disease. When I go back, it took me decades to come to that conclusion because I was looking at each viral disease like polio, whooping cough, so on and so on, down the list, you see. And when I looked at each one of those, there never was a viral cause there. And when they had the vaccine for each one of these diseases, it already had completely gone away, like measles, mumps, chicken pox, polio, whooping cough. I don't care. You can take the whole list when they had all these vaccines. They're taking the credit for the fact that these things have disappeared. They're giving the credit to the vaccines, but they had almost always gone away completely before the vaccines came out. Every one of those.
Right.
So then I couldn't find an example of a vaccine that actually did what vaccines are said to do: protect you against a viral disease. All right. It's bogus. That story goes back a long, long time, and this goes back before AIDS.
Right.
So, I'm sorry. Go ahead. Looked like you have a question.
Well, why do you suppose that is, that these so-called viruses and diseases, or these seasons of these viruses, have dissipated before the vaccine was even able to be effective?
Okay. When I came across all this stuff and I learned, I wanted to know that too. And you go back and you learn what's happening in the society where these things are popping up. Almost all of these plagues and things happen when there's massive social turmoil, like wars.
Right.
You see, like World War II, World War I, the American Civil War, all the wars throughout Europe. When the Romans were, there's always, well, they destroy the food supply, the population, the quality of the water. They disrupt a normal, healthy society. And guess what happens when you disrupt a normal, healthy society? People aren't fed properly, or the water's contaminated, or whatever. They get sick.
Right.
Right. And then when the wars are over with, or the catastrophe, I mean, even if it's like a hurricane or a flood, the same thing happens. People get sick, as a consequence of the destruction of their environment. And then at some point they get hit, they either die, they get better, and it goes away. In all of these plagues that we're talking about, there was some great social turmoil at the time.
Right.
And certainly for the ones that I was looking at.
Yeah. And I also think too, the other thing that was really underplayed a lot in 2020 and going into 2020, because this all started in 2019. I remember when we had the clinic, we had patients that were getting sick real bad with the flu, was the immune system, the natural immune system. They never, ever mentioned anything about, taking care of natural, yourself with, proper diet, nutrition, exercise, and the things that a good, healthy immune system would do. They just played that down completely. And then they started with the mask back in, July or June of 2020, at least where I was in Vegas. Masks weren't even implemented right out of the get-go when they says, well, this is a novel virus, it's unknown. There was just too many inconsistencies. And even one of the biggest inconsistencies to me to this day, and everybody that I interview, is with a virus where if you contracted it and got sick with it, you had a 98.5% chance of surviving. Okay, 98.5% chance of surviving. If I get in my car to go to the gym, my chances of getting into a fatal auto accident and getting killed in a car are much greater than catching the COVID virus and dying from it. Am I right?
Well, yeah. Let me. You're right. I mean, what you're saying is right. I don't want to get off track there.
Yeah.
Let me tell you, just to cut to the chase.
Sure.
Remember, the AIDS thing was a drug disease. That was
right.
It was recreational drugs. That explains why it was limited to gay men at that era, back in the 70s. They were using inhaling nitrite inhalants. I'm a chemist. They're very toxic and carcinogenic things. I would not open a bottle of that stuff outside of a fume hood. These guys were like, they go to a nightclub, they inhale like about 15 milliliters, and they do it on a regular basis. That's why they got this Kaposi sarcoma in the lungs and throat and the face and stuff.
Mm-hmm.
And then the IV drug users. In fact, the CDC understood as early as 1982 that AIDS in the United States was primarily a drug disease, chronic drug use. And then, of course, that changed in 1984. They just totally erased that and just kept going. The contagious disease that they claimed AIDS was a contagious disease was a lie. It was not a contagious disease. Never was. All right. The idea that COVID even existed, that there was such a thing as COVID-19, is a lie. Absolutely a total, complete lie. If you go back and you look at the statistics of 2000, remember that was when the plague started, or the epidemic started, or pandemic started, and you look at the all-cause mortality, the death of any cause in the United States, the total number of deaths in 2020 was less than the previous 5 years.
Right.
Where we had no pandemic, all right? So where was the pandemic? And you pointed out you got a 99.8% or whatever it was.
Right.
Ability. I mean, it was totally bogus. And let me tell you what's going on right now. Might as well spit it out real early. I tell you what I think before I forget it, because it's current. There's all this hoopla about they still want to maintain pandemics. You see,
right.
Even though they're phony, even though they're absolutely totally phony, they don't mind. They're willing to sacrifice the idea that it was innocent. So they're willing to say, okay, it was an engineered virus, that sort of thing. So they don't want the virus to go away. They don't want the notion that it was a totally harmless virus that nobody to this day has. There's no SARS-CoV-2 in a bottle anywhere in the world. Even the CDC admitted early on they didn't have a sample of it to use as a reference for their PCR tests. And in fact, people have looked for it in the scientific literature. Nobody has SARS-CoV-2, just like nobody had HIV. But at least they had this Frankenstein HIV that only exists in the laboratory. Robert
right.
Gallo's thing that you can actually give. That the FDA will give it to you. Not FDA. The NIH will actually give it to researchers for free so they can do research on it. But it doesn't exist in people. It's not contagious, and it doesn't cause any disease. The same thing is true with SARS-CoV-2, except it's even less. They even have less information about it than they did HIV. At least with HIV, they had these artificial exosomes in the bottle that you can get, and you can see them under electron microscope. But they don't even have that for SARS-CoV-2. They don't even have the phony little virus itself. SARS-CoV-2, the only place it exists is in computers.
Yeah. Well, let me ask you. Let me ask you a question, though. I remember back in 2003, we were confronted with, in the fall of 2003, going into 4, the SARS, sudden acute respiratory syndrome, which was a COVID virus, supposedly.
That was
that was a coronavirus, right?
That's what they said.
Yeah. So that caused basically the same symptoms and the same illnesses as H1N1 and all the other upper respiratory tract infections that are contracted through these viruses, bad flu season, basically.
Yeah.
So are you saying that these viruses don't exist at all?
No,
or
I'm saying the viral diseases do not exist.
The diseases don't exist.
Right. And I can say for a fact, HIV does not exist except in a laboratory. I know that for a fact. All right.
Okay.
And I can say that SARS-CoV-2 doesn't even exist in a laboratory. They don't even have it in a laboratory. They just have the gene sequences.
I see.
Guess how many genes, unique gene sequences there are right now? I know it's over 15 million.
Wow.
And there's only 30,000 nucleotides supposedly in a coronavirus. 30,000 nucleotides. The nucleic acids in there. They have 50,000. Every time you sequence that you go to sequence, they don't have a virus to sequence, by the way. This may come astounding to you. What they do is the story. God, if I started from scratch to tell you the whole story, you could make a movie about this.
You could, absolutely.
Yeah, I know. The first, and I did. I looked at the published publications of everybody who's supposedly isolated or identified SARS-CoV-2 from the very beginning. From China was the first place. It was China. I can't remember. I think Seattle might have been the second one. Then there was South Korea, and I don't remember, but China was first, and Seattle, Washington was in there close. And they always, guess what they did? It's amazing. Think of it. They took a single person with some symptoms, And now let me go back a moment. The symptoms, according to the CDC, of COVID-19 and the flu are identical.
Right.
Identical. So right. The only way that you could distinguish between the flu and COVID-19 is with a bogus test.
Right.
So it allows you to name something else. You see, that's scam that they did with AIDS and so many other things. They renamed drug diseases as an infectious diseases AIDS. You see, they've renamed a flu, a seasonal flu. That now they call it with a test. They call it COVID-19.
Right.
So the trick. They did that with the SARS, the MERS, the Zika, the Ebola. The same trick. It's just they just create these things out of thin air. Now, and when they do that, so what did they do? They take a single patient with symptoms, flu symptoms, all right? And they don't take a control patient, somebody healthy. And they take a sample of this person. Typically, at the beginning, it was a lung sample because it was like a pneumonia type of stuff. And then they take it to pieces. They have chemicals and enzymes that just chop all the nucleic acids in that gamish, chop them all up into tiny pieces, hundreds of millions, maybe even billions of fragments. All right. Then they have these machines, these computers. They'll sequence these things, hundreds of millions of these things, and then they get might read them off like the A, T's, C, G's, and if it's
right.
DNA. All right. And then they have these little fragments. Then they have computers that will overlap them just in the computer, and they have, jillions of these things.
Right.
And then they basically already know what they want to find before they even get started. They want to find a coronavirus. All right.
Right.
So then they use the sequences. Remember, they've been working with coronaviruses in general for decades. Like you said, the first SARS and so on. So they've already decided what a coronavirus genome looks like. They have all these lists. So then they look for the sequences. Lo and behold, they can find it. The thing is that they didn't have a healthy control to demonstrate that the sequences are not in a healthy person. Right. You see?
Yeah.
So in every one of those cases that I looked at, every one of them, from China, from the United States and South Korea, and I think it was Australia was the place. And I eventually just stopped looking because they all do the same thing. They all do the same, a single patient and no control patient. All right. They broke in every rule you can do with trying to for a contagious disease, with isolation, purification, and the fact that they're using all this technology and they spend billions of dollars on all this stuff, and it's totally bogus. It's total fraud.
Yeah. And it's interesting you say that, because what it sounds like you were saying too earlier when you allude to the AZT drugs and whatnot, is that the AZT and the mRNA vaccine, these are all like the linchpins by the pharmaceutical industry to create these drugs to basically make money, the big pharma to make money. And it also, what's interesting too, that which was really, really interesting, was with these vaccines, what we saw was they were rushed under what's called emergency use authorization. The whole thing on both sides of the political spectrum was used as a political football, just basically to politicize it at the expense and health of people. And now that everything's shaken out after the last 3 years, we have people that are around and haven't made it that are testament to the efficacy of these vaccines and what they're doing to people. So it just, to me, it seems like people can't see by now that there's this relationship between big pharma and what's happened with the coronavirus. Then I don't know. I don't know what to tell people. I mean, where do you begin, right?
That article that you mentioned that I wrote called Tyranny of Dogma on my website, people could download it. That tells that the story, Marcia Engel and a whole bunch of other people, professionals in the pharmaceutical industry or in the medical journals and things, that saw this really early. They wrote books about it. They talked about it. There's nothing new here. It's just
No.
the public doesn't know about it. The pharmaceutical industry is a very, very dangerous industry. They don't live if people are, they have no business if people are healthy. When I was in the pharmaceutical industry before I left in the mid 90s, the vast majority of the new drugs that we're working on were to treat the diseases caused by other drugs. And now, I mean, and that's what money is made of, is incurable disease. And here it is at little Greensboro, North Carolina. It's not that big a city, but you should see all of the healthcare. These massive healthcare places are all over the place here.
Sure.
And the human beings, certainly in the industrialized world, it's always been true in places like Africa and poor places. But that was because they were poor and they were starving, and they didn't have governments that really gave a damn about them, but in the Western world, we're basically just poisoning ourselves to death. And we're taking, with the pollution that's around, with the crummy food that people eat, and all the drugs and the pharmaceuticals that people, these drugs are dangerous, There's probably not any good ones. If there are good ones, there are a handful. I guarantee you, there's only a handful of them.
Right. Right.
These things, I think there was 20-something anti-HIV drugs. There might even have been 30. I forget the exact number. They all come with a black box warning label that comes with the instructions or the thing that come with the drug that doctors don't read. And the black box warning label is the highest warning that the FDA puts out before they take the drug off the market.
Right.
All right. But there's not one off the market, And
Right.
now I don't even think they use the black box warning labels for other drugs anymore. I mean, the pharmaceutical industry is creating their own business by making people sick. And worse than that, they're killing people.
Yeah. And I heard an interesting statistic. They said, the statistic was that if you get, I don't even know, like even 5 adverse reactions that lead to death with a vaccination, right away, it should be investigated and looked at.
Oh, it had been stopped.
It stopped. Right.
Yeah.
Right. And again, they freed the pharmaceutical companies from liability with the vaccines. They used it under emergency use authorization, which basically, in essence, made the public the guinea pigs in the experiment. And they're still pushing it. To this day, they're still pushing it. And I guess my question to you is, as a scientist, with your years of experience, where do you see this all going in the future? And I know you don't have a crystal ball, but where do you see it going?
Oh, Lord. That's a biggie. I'm glad you asked it, because I've been thinking about it actually since 2020. Basically, these institutions are so corrupt, they're not fixable.
Nah.
The pharmaceutical industry needs to be basically bulldozed. All right. The federal government is criminal. I mean, the pharmaceuticals are criminal, but all of these mega unaccountable institutions are totally unaccountable. It's basically the weapon that's being used, always used against humanity, is concentrated, unaccountable wealth. Always. Yeah, right. You don't have these big wars if you don't have like kings, and big governments, and with industry pouring money. When people realize that the same industries were funding both the Nazis and the Americans and the British at the same time during World War II, during World War I, even in the Civil War, you know. I mean, once they see that war is what money is made of, the whole point of it is destruction. And guess what? When you have destruction, you have to pay for the things that cause destruction. And then you have to pay to replace it, So there's always money going around, and those people. I mean, that's what's going on right now. I really truly believe that we're in the midst of World War III right now, and but it's global this time, literally global. Yeah. And the weapons are the weapons they've always used, plus new high technology. So I think we're basically in a global urban renewal thing, where you go in and you bulldoze as much stuff as you can, You want the airplanes to fall out of the air, which they haven't yet. I'm really surprised. Basically, the pilots themselves are refusing to fly if they've been injected. That's why we haven't had these huge catastrophes. A lot of pilots now are pulling out, even though the FAA would allow them to fly. They changed their rules, to allow sick pilots to fly. The reason we haven't had planes falling out of the air in the United States and probably around the world is because of pilots pulling themselves out and not flying these things. But that's probably not going to last long. But we haven't. When I moved to North Carolina, when we moved here in 2017, I might hear 1 to 2 sirens a month. Now I'm hearing anywhere from 4 to 10 a day.
Right.
A day for 2 years.
Right.
Now that's nuts, and I mean all the signs are there, all the signs of the insanity, all the signs of planned intention to kill people, destroy society. If you can't see it right now, after 3 years, you'll never see it. I'm afraid.
I know. I know 3 people personally that died from the vaccination personally. Now, do I know anybody that died from COVID? No, I do not. I have family members. My sister got it. I know people that got it in my family, the COVID virus, or got sick, got the flu, I should say. But I know 3 people who got the vaccination personally and died. One was 30, one was 50, and one was 65, and they were all healthy, especially the 30-year-old. 30-year-old just supposedly dropped dead from a heart attack. Yeah. So, I don't know anyone. There are probably millions already dead, just from these injections around the world. My guess is there's probably at least 1 million in the United States have already been killed just by the injections alone. Yeah. That doesn't include the millions that are dying from they lost their jobs, they might commit suicide, or who knows what else is going on because of the insanity that's going on right now. And this is by design. How I've been able to look at this, and once you take this perspective, I think you understand things better. Back in, like I say, 2020, when John Rappaport called me on the phone and said, "Dave, you got to join this fight," is that once you know what the intention is, the intention now is to destroy the world and take it over. Take all the resources, all of the property that people own and everything. Once you know that, and you don't want the people to know it, because the thing is, we outnumber these people by 1,000,000 to 1. The ones that are behind this. So they have to slowly kind of kill you off. If they killed you off too quickly, you'd know it really quickly, and you'd probably take some sort of action. Right. And then they totally own the media. You know this story. They totally own the media, own the government. They own basically everything. They've been doing this for decades, and that's where all that money's gone, to own these things and bribe these people. Now, what would you do? What would you do? If the stated goal of some of these lunatics is to reduce the world population down to about 500 million people. Right. A little more than, half again as much as in the United States, I guess. Yeah, and Gates made that clear too. He said that. That's another thing that really gets me is this stuff is so obvious. It's like right out there. I mean, you were, like I say, in the hotbed of the AIDS epidemic back in the 80s and 90s, and there was no dissemination of information like we have today at our fingertips, literally with cell phones, smartphones. You got to basically have a computer in your hand. And back then, you didn't have that. And of course, you had a smaller population of segmented population that was affected by this so-called disease. But today, we have so much information at our fingertips, so much, and yet people are still buying into it, and they're still getting their information from CNN and MSNBC and Fox and all these other outlets. And you talk about the misinformation, that's the misinformation. And they're scoffing at, scientists and physicians and people that are credible in the industry and censoring them. I mean, it's obvious that when you're censoring someone that's an expert in something, then they're doing the right thing. They know what they're talking about. right?
Yeah, I actually think everything you said is true, but I think people, these are tools, and these tools can be used weapon against you or for you, and but people are learning. After 3 years now of this insanity, a lot of people are waking up. I think maybe
so.
a third of the United States, which is huge, huge number, and they're not fighting back real strong yet. I think it's going to have to take more of a crisis for that, unfortunately. But I think they know the scam. There's a large number of people, maybe a third, that I don't think you can help those poor folks. Maybe right. Not even that many. Right now, and we are communicating. There are two good things that come from a crisis like this. I can only think of one of them. It was the AIDS thing, but now with the global thing with COVID, I've actually thought of another one. It's the wonderful people that you get to meet. Like you and I, we would never gotten together.
Never. Right.
Thing. And all of the other people, I've worked with Robert F. Kennedy Jr., helped edit his book, and I'm working with lawyers on 4 continents and all kinds of people. We get to know each other, learn about the economic parts of the world. Catherine Austin Fitts and these other people, we get to. So it's these absolutely wonderful people and these interactions that we get to have that we wouldn't have otherwise. And what we're learning as a consequence of that. Think of all the things I'm learning more now, I think, in this past 3 years than I could ever remember before.
Exactly, your whole career
of this stuff. Think about that.
Right.
That is what these people are trying to control the world do not want to happen.
No, of course not.
It is happening because of the same technology.
Absolutely.
Stuff. I'm talking about getting out there and talking.
Yeah, absolutely. Absolutely. And I don't care what anybody's audience size is. I think the sheer numbers of going on to different podcast episodes and different television shows or whatever you got to get on to get the word out there, because you got some deep pockets behind these huge media companies that are just trying to squash this. And the thing that I want to say to anybody that's listening to this podcast and any future podcast episodes and watching it that I put out there in the future, and I'm sure you'll agree with me, is that take a step back and don't look at this from the optics of politics, because this is not a political issue. It's not. It's a health issue. It's a personal issue. It's an issue that can affect someone and yourself, whoever's listening and watching this, physically. I mean, it can literally kill you. This is not politics.
I have to say this: it's not a Republican and Democrat political issue, but it is political in the sense of power.
Oh yeah, absolutely. Right. But I'm saying
is to rob us of any kind of power.
Yeah, don't take side. Listen, I see people who still wear masks to this day. Yeah. There's people still running out and getting vaccinated. And the only thing I could tell anybody that's doing that, and I'm not doling out any medical advice, is just take a deep breath and take a couple steps back and really look at the entire optics of the entire situation. Don't just listen to Fauci or any of these clowns that have been putting this information out, because that's what they have been. Listen to the professionals, the people that have been in the industry, such as yourself, such as Dr. Judy Mikovits, Kennedy, and everybody else that's credible, that's done some research and backed it up with research. There's
a lot of good journalists out there. There's a lot of good professionals. What I mean by professionals, I mean people that know what they're doing. They have a good, solid foundation in areas that that they work in, and these people are extraordinary resources, and they're not stupid.
No, but
I'm even proud to be associated with them.
Yeah, I mean, I never would have started this podcast if I had never seen a patient in my life and owned a medical practice or anything, because then I wouldn't know what I was talking about.
Yeah.
But firsthand knowledge of like I say, professors and researchers and doctors and people that are, you don't go to your, shoe repairman to take care of your medical condition. You go to people who have experience with these things, that are in the know, right?
Yeah, I mean, and you use your own judgment. Yeah, it's important that people compare what they're experiencing now with years of experience in the past. To get a sense of how weird things are now.
Absolutely.
And that's what astounds me is that attribute seemed to have been waning in 2020 and 2021. I think it started waking up in 2022 substantially, and so I believe it or not, I mean, the worst, we haven't seen the worst yet.
No, I don't think so either.
One thing I'm confident of, that these idiots, these lunatics that have more money than brains by far, they cannot pull off what they want to. They can destroy. They're good. It's much easier to destroy things than it is to build things.
Absolutely.
And these people can use their money to cause a great deal of harm and destruction and death. And they already have, and it's going to increase. And in the industrialized world, I'm afraid that the economics is the next weapon they're going to use at it. They're going to blow the economics, the livelihoods away from people.
Oh, absolutely.
And I mean, they're going to use every tool of destruction they can think of.
Absolutely. But nobody wins in the end. Nobody wins in the end. They don't even win in the end. In the end, they don't win. Nobody wins. Man destroys man, right?
Yeah. I mean, there's no rationale to it. I mean, it's pure evil. I mean, I remember back in 2020, when I thought about this stuff, and I was, right after I talked with John Rappaport on the phone, I realized immediately that this was a spiritual war.
It is. I've said that. Yeah.
War. I'm talking about a spiritual war, which everybody of any faith or non-faith or whatever, any artist, any human being, I think even animals, when you look at it, they know good versus evil.
Yeah, this is good versus evil. I've said that in many podcast episodes, for sure. There's no question about it.
Right.
We're not fighting against blood and flesh enemies, but against principalities and spirits. And that's what this is. These people are horrible. They're possessed. But it catches up to them. It will. It'll catch up.
They're already. Let me tell you another thing that occurred to me. Just think about this. See if it makes any sense to you. A lot of people say when they said it when this first started with the isolation and the mask and all that, the people were talking about how isolation makes people mentally have problems. And they can go nuts and stuff. Well, think about some of the billionaires. Think of the people that have whole huge amounts of money. All right. Guess what? These people are self-isolated. They do not come in contact with you and me and regular people. They don't.
Right.
They don't have anything in common with us.
Right.
That's why they don't care. It's like how humans have treated animals a lot, except for people that lived around animals a lot and really cherish them. They discount them. It doesn't matter if they die or if they whatever they do to them. That's why you think about us, because they're insane relative to the rest of humanity.
Yeah.
They don't know how to behave otherwise.
Yeah. Well, there's a saying, it's lonely at the top.
Yeah, it's lunacy at the top.
It's that too. I interviewed Dr. Peter Breggin. He wrote a book called COVID-19 and the Global Predators, We Are the Prey. He was really interesting too. And he has the same perspective on this whole thing. I just don't think it's going away. I think we're in for, especially next year with, so-called election year.
Worse than this year. And this year is going to be ultimately worse than last year.
Yeah, 2020 was just their dress rehearsal, I think, for all this stuff to come, because they're making it clear. I mean, the World Economic Forum and this Klaus Schwab and his sidekick Yuri Harari, whatever his name is. I mean, these people are not done. I mean, we're in their playground is what we're in. The thing is I think as individuals collectively, we have to look at this for what it is. We have to take a step back, and there's more of us than there are of them. And that's what we have to realize. The power is in the people. It's not in these lunatic clowns. It's in the people. we collectively make up more as a number of us than them. So people have to be united. United we stand, divided we fall. That's what that means.
Yeah.
So people have to become united. And they, like I said, they got to take the politics out of this on both sides. This is not a Democrat or Republican or independent thing. This is just sound, intelligent thinking and taking a couple deep breaths and stepping away and looking at it for what it really, truly is. And it's evil. It's evil. There's no question about it. You don't have to be a political person to see that. And I think that was the problem. And I even mentioned that on my website, Medical Truth Podcast, is that this became a big political football, is what it became over time.
Right.
You know?
I forgot what I was going to say. Never mind.
I'm sorry. I got on my soapbox there.
What? No. I agreed with you. What you're saying was right on the money. The reason why they're intentionally trying to kill us in large numbers is because we outnumber them so much.
Right.
Okay? And the only way to get control is if our numbers are 90% or 95% reduced.
Yeah, absolutely. Yeah. Absolutely.
So realize that they're really afraid of us. And the only way they can do it is if we're gone, by and large.
Right. Right. And if you look at the political side of things, and I hate to get political because I don't want to, but the Republicans and the Democrats are not doing anything about it for any of us. They're not in it. Neither side has our best interest. You can see that. It's been obvious.
Yeah.
You know, it all falls on deaf ears a lot of times.
Are you surprised?
No, I'm not surprised.
I'm not. I mean, they're never working for us.
They never were.
No. They work for the people who support them financially to get in office, the people that keep them in office. I mean, it's
exactly
just like the FDA and the CDC. Yeah, I think 75% or approximately of the FDA's money comes from the pharmaceutical industry.
Absolutely.
Surprise.
Right. And that's where I got to see people. That's where I tell people you got to see it for what it really truly is. Again, this is not a political issue. This is good versus evil. And you got both sides colluding against the people. And it's just really one party. It's a big illusion is what it is. And it has been and always will be. And their evil game is to divide people. That's what Satan wants to do. Satan is famous for deceiving and lying and dividing and destroying. That's what Satan does. He deceives, divides, and destroys. That's it. And if you know that, the basis of that, then there's nothing right. There's nothing new under the sun.
Yeah, divide and conquer.
Divide and conquer. And we're the pawns if we allow ourselves to be the pawns.
Yeah. I just feel sorry. I mean, you can't help but feel sorry for the people who have basically allowed themselves to be tortured and killed. I mean, they weren't consciously allowing themselves to be tortured and killed. They just were sort of in a daze. You know?
Yeah. Well, and I understand it. I get it. And I'll tell you the reason why I get it. I get it only for the simple fact that you've got so much money being thrown at, like we said earlier, through the media and all this money, because that's what the power is for them, is in the information and the squashing of information and trying to censor people like me and you. And they'll even use the words, they'll gaslight. They'll use, they gaslight. They'll call us conspiracy theorists. How could you be a conspiracy theorist? You've been a scientist your whole life. You got to know some truth about something in science, right? Doctors have to know some truth about. And I think that's where things, like I say, are shaking out now, where you have people that have lived through this, have been vaccine injured, or some people have died. The people that I know have died, that are living proof that this is not a conspiracy theory. Right. Yeah. It's not a conspiracy.
I think that's what a lot of people now have witnessed the harms, and so the thing is that they know what's going on. The thing that troubles me is there's not a big counter push. It's like people are still just getting along with their lives. They don't get injected and they're just trying to feed themselves and all that. Right. I wish there was some way for us to get together and say no and to push back. I've been trying that now for 3 years here in North Carolina and gotten zero. I just can't get anywhere.
Yeah.
The Guilford Patriots, a good bunch of people and everything, but they were too hung up on the typical, election, political stuff. We'll vote for the right person. It totally has absolutely no effect.
None at all. That's what I keep saying. It's not a political situation.
Not that kind of situation, and so there are some little co-ops starting to grow here. My wife and I, she plants the garden. I pick it and cook it.
Right.
Neighbors have done a big one over here, and other people are doing that. And so, and there's these other little co-ops that are starting up, but that's good. And I'm all for that. I've always been wanting to have a public display. I'm a real believer in examples. It's not what you say, it's what you do that really counts.
Right.
And people want to, instead of voting and all that, go out and demonstrate to City Hall and to these other places. I was my wife and I, she would have the camera and all that. I was the one person in 2020 walking around with the signs and the T-shirts and all this, going off various places.
Sure.
People would say, honk their horns and everything, but nobody would join me,
Yeah.
And still, that has not happened here,
Yeah.
And I'd like to put pressure on the local newspaper, put pressure on City Hall, put pressure on the governor, who's a crook.
Yeah. Well, you got the fox watching the hen house. How are you going to... It's like ready to run to. That's why I say collectively people have to get on board, like you said, and get with the plan, because, and then we've got so many other things too, like, the virus thing, and the vaccine thing is one thing. Then, a lot of people.
That's a total diversion, but people don't know that.
It is. And there's a lot of like I said, gaslighting and distractions that they push on left and right for people to be distracted. But then the other thing that I've investigated by just simply looking up at the sky are these chemtrails, and that's a real thing. Yeah, that's a real thing. I mean, you got contrails and chemtrails, and that's a whole nother subject that we can talk about later.
Yeah.
But
you get bogged down. One of the things that I've noticed with lots of folks, they get bogged down in a niche area.
Right.
Vaccines or the schools or this. Those are important things.
They are.
Especially for the kids, you should really protest. You should go out there with the parent-teacher associations, whatever. You should do that. Totally agree with that,
Right.
But some of them just get so focused, like right now, this virus stuff, and it's all just distracting, and keep from joining together and as a bunch of warriors, and that's what I have been trying, waiting, as soon as I see folks, I'm with them, but I don't see them going out there and doing it.
Well, it reminds me of the shell game is what this all is. You got global warming, you got the vaccines, you got the virus, and then they're just moving the shells around. Yeah. And we're just like looking, and we're just so discombobulated by all this stuff. And then, of course, you got to feed your family, and you got to keep your job, and you got to pay the mortgage, and you got to pay the electric bill. So it's like you could see why people are so.
If we really believed in our Constitution and our country and all the stuff that we thought we knew about ourselves, the number one thing, you can leave all that technical stuff behind and realize the number one thing is our freedom, our liberty.
Yes.
Give me liberty or give me death, that sort of thing. And that's where we're at right now. People have to I know it. I knew that instantly in 2020. This is a war to the end, to the death.
It is. And it's so funny. What's interesting, Doc, is I was thinking not a couple of weeks ago, I said to myself, I was sitting there and I'm shaving in my bathroom, and I says, the Amish really have it figured out, man.
Well, they have it figured out a long time ago.
They have it figured out, because here you have a group of people that are united, right? They build a house together, they farm together, they do all these things together. They're united. They don't use cell phones. They got a horse and buggy. They don't have to worry about gas and electric cars.
Yeah, we have those Amish communities here in North Carolina. We visited one recently. Yeah.
Yeah, and we're the ones that are sitting. We're the. I don't want to use the word, but we're the dummies that we get ourselves so caught up with all this stuff. And oh my gosh, I think I'm going to throw my cell phone away after we get done with this.
Yeah, I don't have a smartphone. I just have a flip phone.
Good for you. You're smart.
And I wish I didn't have that.
Right.
But, I mean, technology is like any tool. You can use a hammer to build a house or hit somebody over the head and kill them.
Right. That's true.
You can turn any useful thing into a weapon.
Sure.
So I don't hate. I hate the excess. I mean, there's too much technology. You could say excess, like we have an excess of. We have an excess of most everything, and it's the excess, the imbalance. That is very, very dangerous and destructive.
Yeah.
And that balance has to be. That's one of the things I guess about the Amish. They knew about balance.
They did. Yes. And that's what I was saying earlier about this whole thing is that we're just why I understand why people ran out and got the vaccines. They were sold on a lot of that, and they were coerced into that.
It's also,
what's that?
It's also habitual.
Yeah, absolutely.
They've been following instructions for a long time. They followed a vaccine schedule for themselves, for their kids. It's habitual. It's non-thinking. It's habit. And I understand that. It doesn't mean
me too.
Because a lot of the people that now, a lot of the parents, and I've seen this with the mothers over the decades, they went into it and then they saw what the vaccines did to their kids, and boy, they're warriors. The women are the warriors. I swear, honest to God, the women are the warriors.
They are. And absolutely.
And they see this stuff really fast, and boy, they'll fight it and they'll do anything to protect those kids.
Yeah.
Basically, I think that's what we're basically, I think, before we get to where I want to be, there's going to be a lot of suffering that has to happen before people say enough is enough. Unfortunately, I think that's what it's going to take.
Yeah, I agree. I had an interview. I interviewed Dr. Paul Thomas, and he's a pediatrician who actually, and he brought in a numbers guy, a neonatologist friend of his. He was a numbers guy, statistician, into his office before they took his license. Oregon took his license over that. And it was interesting because he found that the non-vaccinated versus the vaccinated were much healthier, the vaccinated were, than the vaccinated patients. So he brought this data to the Board of Medicine in Oregon as well as the CDC, presented it to him, and they took his license away. I know. And that didn't surprise me.
I know. I mean, they can't allow that. You see, you know you're on the right track when they.
Absolutely.
Duisberg, this guy was world authority on these retroviruses, of one of which is HIV. Is saying it's totally bogus. So. Yeah.
And then Dr. Peter McCullough.
That are victimized right off the bat, there's a lot of truth behind that.
Yeah. And this all gets back again to one thing. We all have to just get on the same page and be united. We have to. It's us against them.
You talk about the same page. To me, liberty is the page. Is that page. But I don't mean that there are other things like your kids and stuff. You have to take care of that. But if you focus on the vaccines or you focus on this or focus on that, that's not the page. To unite everybody on.
Right.
It has to be liberty.
Liberty.
It has to be, I don't want this,
Right.
And I want that,
Right.
And I get to say, and all of us together, everybody who wants to say out loud, I'm in control, not you.
Right. Give me liberty or give me death, right? And not death from the vaccine.
I mean, really, basically that's what it is. But you only see it when it gets serious enough.
Right.
Right now, you think, well, it's going over there. It's happening over there. It's not happening right here, right now. But when it does happen right here, right now, what are you going to do? Yeah.
Thank you so much for unpacking this and clarifying a lot of the misnomers about, and paralleling the HIV situation and COVID and all that. It's really wonderful to have you on this podcast, the Medical Truth Podcast. I'd like to have you back on again and keep me updated, and keep the audience updated on your work and what you're doing.
I'm happy.
That would be wonderful.
It's a privilege, honor to be with you, and I
thank you.
And I'll be with you anytime, man. And
thank you. Yeah,
so
thanks, Doc. And again, what's your you go ahead and mention to the audience your website.
My website is David Rasnick, DavidRasnick.com. And there's tons and tons of material on there. You can go to my little email thing if you have any questions. And I'm happy to, I try not to say no. People send me emails, they call me up, I talk to them, and I do as much as I can, to help you along. There's a reason there's lots of information on there. It should be useful. I hope so anyway.
Yeah. Thank you so much again, Doctor. Appreciate it. Thanks, Dr. Rasnick.
Thanks for listening to the Medical Truth Podcast. For the latest episodes, go to www.medicaltruthpodcast.com. You can also find the Medical Truth Podcast on Rumble, as well as all the major podcast platforms like Apple Podcast, Spotify, Stitcher, and iHeart.